do Kinesio tape. You can go ahead and do my face for a second. And what you need to do is get really good quality Kinesio tape like this. You can do Kinesio Text Classic or Gold. Both of them work great, and this is slightly cheaper than the Gold. But this is a stretchable tape, okay? And so what you do is I usually measure it by the blocks, and in this situation, I'm doing lymphatic drainage, meaning that I'm decreasing inflammation. And so you don't stretch it that much. Okay, so I'll show you what that means in a second. So if I go down right to here, I'm going to try to cover as much as I can of the calf because this patient is having a neuropathy down here, and I think part of it's coming from the calf. So, and a part of it's from inflammation, and so what I'm going to do is put tape on so that the inflammation goes up. You always want to move the inflammation up this way to the rest of the body upward so that it'll take it out of the body, the inflammation. That will help hopefully take the pressure off the nerve. So in this case, I'm probably going to go ahead and you don't want to go below the ankle, yet. I'm going to try it first on the calf, and so if I go like about right here, now the tape is going to be stretched out a little bit, so I'm going to do probably about this long here. So we're looking at about 5.5 blocks. So I'll do 3 strips of 5.5 blocks. So here's one. Another 5.5 blocks here. And one more. Okay, so now we've got the strips. Now sometimes people do cut the corners. So if you want to do that, basically it sometimes helps it to stay on for longer because there's no rough edges, rough corners to grab on anything. So in this case I am going to do that, and I think it'll, because you want to wear this for 3 days. It's not a rocket science, but just cut the corners off. Okay, so now what I'm going to do is apply one at a time. In this case, I'm actually going to surround the whole calf where the muscles are. And the muscles that are involved in usually treating the feet are the deep calf muscles right through here. So I'm going to put one directly on the side, directly on the back, and directly on this side of the shin bone. So here's the shin bone where if you get kicked, you get bruised. You go both sides of the shin bone. Okay. And one right here, and one directly on the back of the calf. That you're gonna have to just imagine it because I can't video it at this point. So I'm gonna do the 2 in front. Okay, so what you do is you want to start at the application here for inflammation, because what it does is when you stretch it, I'll just show you. You take about 1 inch off, you rip the tape. Okay, and obviously you don't want to have any oils on the leg that you just put because it's not going to stick very well. If it's dry, it'll be fine. In this situation, I'm going to actually use this called Tough Skin because this patient is very active and sweats and does a lot of workouts. So I want to do a little bit more of an application here. And in this case, I'm also going to probably shave off some of the hair here as well so that when you pull it off, it's not going to pull the hair with it. So you go ahead and pause it just for a second there. Go ahead. You have shaven, then basically it'll, you won't pull the hair off. But so what you want to do at this point is you want to start applying it. And so the general rule of thumb is, and I'll just show you how to do this. You're going to stretch it for inflammation. You're going to stretch it a little bit, like maybe about 10% of a stretch. Okay, not that much of a stretch at all, because you can stretch it like really firmly, like a big stretch, or you can just do a little stretch. So with inflammation, you don't need to do that much. So I'm going to go right to the ankle bone right here. So if you stretch it, you're going to stretch it 10%. You're going to have to start up here because it's going to go down to here. Does that make sense?
Mm-hmm.
Okay.
Yeah.
So you pull it off. There's no stretch on the end here, so you just lay it down. Okay. I'm going to do it right next to the shin bone. So here's the shin bone, hard shin bone. You want to do it a little bit over the muscle. So where the shin bone drops off, that's when you do the right in the middle, right through there. Okay, so about right here. This is not rocket science. So now I just go like this, and I'm going to put a little more, put some adhesive on here. And you don't want it to be like an exorbitant amount, so I just do that. And then let it dry a little bit, and then once it's tacky, then you can apply the tape. Okay, it's starting to get a little tacky now. So if you put too much, obviously it's going to take long to get tacky. So this one here, there's really not too much you could do except go like this. You want to extend, you want to stretch out the muscle. So basically you're going to go like this, and you're going to, like I said, about 10%, and then at the end you're going to drop it down. So the ends do not have any stretch. So I just go like this. You know, this, it could wrinkle. Now, it's not the end of the world if it wrinkles, but it's better if it doesn't. Then you rub it like this, okay? So the heat will activate the stickiness. So I rub it down this way and then up because you don't want to wrinkle it. You know, you don't want to peel it. So that's the first one. Second one's going to be the same thing. You're going to start off with. So you can do, here's the bone. So the anterior tibial muscle is right there. You can see it pop out, okay? You want it right over that muscle because that can pinch the nerve. So we're going to start about right there. Okay. Okay, again, you take the end and just rip it. And then when it gets tacky, you start putting it down. Okay, just a little tacky now. So start about the same edge as the other one, and you rub it. Now this one, he's stretching it out, right? So you're going to stretch that muscle down this way. Now some of this requires a little bit of anatomy, but some of it is just common sense. So in this one, you stretch out that muscle and you lay it down like that. It's better not to overlap the ends over another piece of tape. You want the end right over the skin because it sticks better. So try not to get, it's okay if it overlaps in the center, that's fine. But at the end, you generally want it to be on the skin. Okay, so that's how to do kinesio tape. Now I'm going to do one more application directly in the middle of the calf. And you do the same thing, but in that case you stretch it out at the end this way because you're stretching out the calf muscle. You start it right at the same part on the back, and then you stretch it down about 10% and end right at the Achilles here. You know, in the Achilles, and there's a thin Achilles tendon right there. You're going to have to surround that a little bit. And so you just fold it over the Achilles. Okay, so that's it.